G'day everybody and welcome to the latest video on reflux, also known as GERD and GORD. Now the reason why one is GERD and one is GORD is they both stand for gastroesophageal reflux disorder, but in America esophageal begins with an E. In Australia, the UK, New Zealand, esophageal begins with an O. Just to confuse a lot of us. But for the day, for this video, I'm not going to go GERD and GORD and reflux and heartburn and sour stomach. I'm just going to call everything reflux. So what is the difference between the two is basically all the symptoms are pretty much the same, except for reflux the definition of reflux is that all those symptoms that you can get once a week or less. So you might get it every 2 weeks or every 3 weeks or once a week, well, that's reflux. But if you get those symptoms twice a week or more, that's your GERD and GORD, okay? So what are the symptoms? Well, they can be that chest pain, that really bad pain in the chest, which is like that heartburn pain. There is the burning or the reflux of the acid coming back up through the esophagus and into the throat and into the mouth. There can be a lot of burping. There can be quite rancid breath, hoarse, sore throat, persistent cough, tooth decay, because if it comes up into the mouth, you can burn the enamel off your teeth and damage your gums. So there's gingivitis. You can have difficulty swallowing. Some people can even have breathing difficulties. Okay, so what causes it? Well, there's quite a few causes. Obesity is a common one, and that's because we've got a lot of fat around the midriff, and that fat pushes on the stomach, and then when you have food and you overeat, that fat can push there, and it's going to catapult the food and the acid back up that way because there's just not enough room for the stomach to expand. Same thing in pregnancy, not caused by fat, caused by a lovely little baby, but that can also, the reflux can also occur in pregnancy. Smoking causes reflux, so it relaxes the esophageal sphincter valve. Now, when we eat our food, the food comes down through the esophagus, gets to about here, and there's this valve. Now I generally say it's like a trapdoor, so it allows the food to go down, but it's more like a series of muscles that squeeze the sphincter, and then as the food comes down, it relaxes the sphincter and the food goes in and then goes into the stomach and then closes again. Well, smoking causes that sphincter valve to do that. So does alcohol. Alcohol also increases the production of the stomach acid. So if you've had a couple of beers at night, or a bottle of wine, or a whole heap of other sherbets, or whatever you're drinking, and you lie down, that esophageal sphincter valve is relaxed and opened, and the overproduction of acid, you're going to get that burn all the way back in your throat, and then you're mostly going to have to try to prop yourself up to sleep, unless you follow some of the steps that we outline a little later on. Hormones can also cause reflux, in particular progesterone, forgot what it was for a second there. Progesterone, which is a female hormone that's quite active in pregnancy and from day 14 to 28 of your menstrual cycle. And what it does, it relaxes smooth muscle. Well, the muscles that innervate the sphincter valve, they're what we classify as smooth muscles. So if they're sensitive, they're a bit on edge, and you get a little bit of an increase in progesterone, poof, you're going to relax. Okay, reflux. What else can cause it? Oh, drugs. Ibuprofen, aspirin, the non-steroidal anti-inflammatory type drugs, they damage or relax that sphincter valve or the esophagus or the stomach. Osteoporosis medication, so Fosamax, that actually erodes the esophagus. Right? That's why you can't lie down for, I think it's half an hour, 45 minutes, an hour after taking that medication. Because if it comes back up here, it damages this, and then everything just comes back up this way instead of going down that way. Blood pressure medication, anti-anxiety medication, antibiotics, tricyclic antidepressants, they all can also cause reflux. There's most probably others. Oh, stress can as well, because stress relaxes that esophageal sphincter, and it can then increase the sensitivity of the stomach and the esophagus to pain. Now, foods. So we've mentioned the pharmaceutical medications, or the classes of pharmaceutical medications that can bring it on. Well, foods can also bring it on, especially if you're quite sensitive. So a greasy, oily type foods, and like your deep fried foods, your fatty foods, but also things like avocados and and nuts and seeds and oils, butter and lard. They're hard foods for the body to digest, or the stomach to digest. So they sit here for quite a while, which means there's a lot of stomach acid being produced, and they relax the sphincter valve. Now, if they relax the sphincter valve, you'll have stomach acid being produced, like with the alcohol, it's going to burble, I don't even know if that's a word, gurgle back up. Dairy can also cause that, so obviously the high fat dairy, so if you know, the whole milks and the whole creams, so if you still want to have your dairy, make sure you try to go the lighter fat dairies or look for milk alternatives. One that really upsets a lot of people that can cause reflux is chocolate. Now, chocolate contains a chemical, and I'm going to see if I can pronounce this word right, xanthine, I can't pronounce that word, but anyway, it's a chemical, it's in chocolate, and it relaxes the sphincter valve. Caffeine does the same thing. So caffeine is also in chocolate, and caffeine also stimulates the production of stomach acid. So, not a good way to start today. Fizzy drinks. So as you can imagine, you take a lot of carbonated drinks, they produce a lot of gas. If the sphincter valve is weak or sensitive, that gas can either push back up that way. So when you burp, you can burp up food and acid as well. Tomatoes, citruses, pineapple, they all contain citric acid, high amounts of citric acid, which if the stomach and if the stomach and the esophagus are sensitive, that is going to aggravate, you're going to get more pain associated with that. So you think it's reflux pain, it may not necessarily be, it may be the citric acid that's causing that pain. Onions, especially raw onions, can relax the sphincter valve. Peppermint, now peppermint is a really great herb for the digestive system. Irritable bowel, bloating, abdominal pain, gas, but it's also a great muscle relaxant. So it's a double-edged sword, so it helps with a lot of stomach or digestive symptoms, but if it relaxes the sphincter valve, reflux results. And obviously spicy foods, because if the esophagus is already damaged, or the lining of the esophagus is already red and inflamed and sore, or the stomach, the spicy foods are going to aggravate it. Now, I suppose I should say that people that have had reflux, reflux is the next step for you get a lot of this acid burn all the time. Well, then you damage the cells of the esophagus, and it's a condition called Barrett syndrome. So those cells then become pre-carcinogenic, which means they're not cancer cells, but they're on their way to cancer cells. Okay, so it's important to obviously manage this correctly, and I'm going to show you a lot more from a natural perspective what can be done to just get rid of reflux full stop. Now, before we go on and look at the natural side, and we're going to look at how the medicine treats reflux, we're really going to have a bit more of an understanding of the process of the digestion, especially in this upper section from the stomach upwards. So, bear with me. When we chew our food, we start to denature the food. We start to break those bonds that hold the food together. Now, when you then produce saliva. Saliva contains an enzyme called amylase, which then starts to break down the carbohydrate components of the food. The saliva, the action of the chewing and the production of the saliva then tell the stomach, hey, food's on the way. Let's produce some stomach acid. Let's get all those enzymes working, and we can start to break that food down. So you can imagine a piece of steak, for example, it's all that sinewy stuff. All the acid starts to melt the bonds that bind all of those amino acids together to create that sinewy meat. Okay, so then when it goes down into the stomach, it goes down the esophagus, the esophageal sphincter valve opens, goes into the stomach, and it's all broken down. So think of it this way. Think of an old building that needs to be wrecked, and you've got this big solid wall, and you've got a crane with a big wrecking ball, and the wrecking ball comes along to the wall and goes bang, and the wall breaks down to big chunks of brick. That's what the stomach acid and the chewing do to your food. From there, the chunks of brick then go into the small intestine, where the pancreas secretes digestive enzymes and bicarbonate to neutralize the stomach acid. If not, you then get a duodenal ulcer. And those enzymes then come to these chunks of brick, and they break it down to grains of sand. right? Now, in the lining of the small intestine, a villi, it's villi, like finger-like projections like this, and just going back and forth, and they've got all these microscopic holes on them, and the grains of sand go through into the villi, and they go into the bloodstream and go directly to the liver, and the liver goes, oh, okay, you're an essential amino acid, I better turn you into a non-essential amino acid. You're vitamin B6 in an inactive form, better convert you into the active form. And zinc, you need to go to the immune system. B1, you need to go to the brain. Chromium, you need to go to the calcium. So it orchestrates all of that, okay? So that's what basically happens. Now, if we don't produce enough stomach acid. Now, I'll go back a step. People believe that reflux is a condition of too much stomach acid. Well, it's not. It's not. It's definitely not. Again, I'll explain. Now, when you break that food down and you've got all that food sitting in the stomach, think of it this way. Go get a Ziploc bag, grab a chicken breast, throw it in a Ziploc bag, close the Ziploc bag, chuck it out in the sun. And then about 4 or 5 hours later, come back to it. That bag will have expanded like this. All these gases that would have, from the fermentation of that chicken, have caused that bag to expand. Well, if you don't have enough stomach acid, the foods that you eat begin to expand and ferment in the stomach. Now, one of two things happen. It pushes that gas, if the sphincter valve holds well, the gas goes down the back end and you're forever playing a tune on your trumpet. You know, right? But if this is a bit weak, you're burping and it comes up this way and you constantly burp. So people that eat food, burp, 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 you burp throughout the day, your breath is rancid. You ever know someone that you go, oh my God, your breath is terrible? Well, it's either something's fermenting in the teeth, not enough good bacteria down low, or most times it's here, it's in the stomach. You've got low stomach acid, which is causing the foods to ferment. So when that happens, you get the fermentation of the food, you get that pressure in the stomach. Well, it's going to push, when it pushes back up this way, you've just had some chocolate and coffee and, you're smoking a cigarette and you've just had some alcohol last night and you thought you'd be healthy and you ate some, pineapple and tomatoes and oranges. Well, you're relaxing the sphincter valve, you're causing an overreduction of acid, and it's going to come back up this way. And the weaker this sphincter valve gets, the easier it's going to come back up. And the more burning and the more pain, because the esophagus gets inflamed, the stomach gets inflamed, and you get a lot of problems. Now, so you go to the doctors and the doctor goes, the first thing you do, you go, I'm going to die. This reflux is terrible. Go into the supermarket or the chemist and you grab an antacid such as Mylanta or Gaviscon. Right? And they contain magnesium carbonate and calcium carbonate to help reduce the stomach acid, but they also contain a thing called aluminium, so salts of aluminium. Well, aluminium itself is quite not very beneficial to the human body, especially in the quantities that you're taking, and it has been shown to have a big link to Alzheimer's in test tubes. It causes breast tissue to mutate, so cancerous. It also causes poor cognition, so poor memory, poor focus, poor learning. It can cause diarrhea, constipation, cramping. So it's not a good thing. Generally people I can inhibit the absorption of sodium and potassium because it sits in the receptor side on a cell that sodium or potassium go into, and it says bugger off, you can't come there. Then the cell itself starves of sodium and potassium. Then if you've tried that and think, it keeps on coming back, you go to the doctors. Now the doctor will do one of two things. He'll give you a H2 blocker. So Zantac was a well-known H2 blocker that has been removed from the market in Australia, Europe and America because it contained a chemical, an MDMA chemical, which is known carcinogen. So they've had to remove that from the market. There's other ones, but I can't tell you what their names are. So they work by, in the stomach, there's endochronophore-like cells. I think that's what they're called, endochronophore-like cells, yep. And they produce histamine. And histamine stimulates the production of the stomach to, I'm jumbling myself here, this should be simple. The endochronophore-like cells produce the histamine, and the histamine then stimulates the body to produce stomach acid. That was a lot easier. So what those drugs do is they block the production of histamine, so the body is not producing stomach acid. Now they're not long lasting, they might be short lasting, they might last for 4, 6, 8, 12 hours. I'm not too sure. And I'll come to their side effects in a sec. And the other class of drug, protein pump inhibitors, PPIs, Nexium, Somac, Pariet, Losec, they inhibit the stomach from producing stomach acid long term. Now, that all sounds good. I go to the doctors, get the pill, everything's fine. Yep, reflux is gone. No, not really. No. Why? Because studies have shown that those drugs inhibit the absorption of calcium, magnesium, zinc, iron, vitamin C, vitamin D, B1, B3, folate, B12, amongst others that we don't even know about, all the antioxidants, all the phytonutrients. Then if you start to do that, there's some pretty serious, ingredients there and nutrients there. Every single cell in your body downstream suffers. Your eyeball doesn't get enough zinc, your immune system doesn't get enough vitamin C, your brain doesn't get enough vitamin B1, and then things start to break down because your body becomes malabsorbed. It's not a good thing. This is not a good thing. Reflux, GORD or GERD, they are not a disease. They are not a health condition. They are your body's way of talking to you. Hey, Greg, come on, listen to me. I'm out of balance. The stomach and the esophagus are out of balance. We're not happy. We're just not a happy camper. We need some love and care. And that's all it needs. And if you give it the love and care, the body regenerates it, and then that dis-ease that it's telling you that you have disappears. I'll get to that in a second. So these medications, they are quite harmful. The FDA, the Food and Drug Authority in America, say that the PPIs, the protein pump inhibitors, should be taken no longer than 4 to 12 weeks, depending on the symptom or the condition that you have and the severity of it, because after that it causes major malabsorption. So one of the things that it increases is the risk of cancer, right? And that's not surprising because zinc, vitamin C and vitamin D, they're the big three immune players, massive. Then you've got iron, which flicks the switch on every single cell that starts to mutate, so it'll die. And if you're low in iron, well, besides your anemia, your cells don't, apoptosis, which is programmed cell death, does not occur. Dysbiosis, which means you upset the ecology within the intestines. So 70% of the immune system lives down the lower part of the intestines. You upset that ecology, you upset the immune system. You then upset the messages that go into the brain. So anxiety, depression, mental health problems, constipation, diarrhea, anxiety, depression, bone fractures, calcium, magnesium, quite important for bones, immune suppression, so that can then be an autoimmune disease, it can be cancer. There's a 44% increased risk of dementia according to the studies. There's chronic kidney disease. I don't think I need to go on any further, do I? Might as well just dig. I'm taking some reflux medication now. I might as well just dig a hole and build a box and bury myself. Don't go that far just yet. But, the pharmaceutical medication is not there to keep you better or to make you better. It is there to keep you as a long-term client. Now, I've had patients come to me on those protein pump inhibitors and they've been on them for 20, 30, 40 years. They were on them when they're 18 and they're 60 now, and you just go, seriously. But they've got all these other health problems. Blood pressure's going up, they've got diabetes, they've got fatigue, whatever. But, if you're not getting the nutrients down in your food, everything's going to suffer. I already mentioned that. So, what can be done? Okay. Well, there's some foods that are going to help. So, things that help with reflux. I mentioned foods that are no good for reflux. So, things like celery, cucumber, kale, apples, asparagus, broccoli, cauliflower, ginger. Ginger's quite good. Watermelon, peaches, all those type of foods. Well, there's much probably more, but I can't remember off the top of my head. They're going to help calm the stomach. Okay, now remember that reflux is a condition that can be healed as long as the body has the right environment or the right nutrients to heal itself. And what are those right nutrients? Well, there's fruits and vegetables and nuts and seeds and legumes and pulses and beans and cows and chickens and eggs and oysters and prawns and herbs and obviously breathing, stress relieving techniques. But it's going to be a bit of a lifestyle change. Now, when you get that burning pain that comes back up here and people have gone for their antacid or their Nexium or their H2 blocker, there's one really simple herb that is going to really down-regulate that pain and soothe the esophagus, okay? I'm not going to tell you what it is just yet, but you've got it, most probably a lot of people have got it in their kitchen cupboard or their pantry at home. Right? And they most probably drink it every now and then. It's the #1 consumed herbal beverage in the world. I'm giving it away. And that's chamomile. All right, so chamomile soothes. It's an anti-inflammatory for the stomach and the esophagus and an anti-allergen. But it also strengthens the sphincter valve, right? This is a big thing. We want herbs or nutrients that are going to regenerate and repair the sphincter valve. Now, I use chamomile in the clinic for this quite often, and I always throw in golden seal with that. Now, golden seal is a herb. It's an endangered herb, but it's such a good, well, it's not endangered, it's venerable. Venerable? No, I think that's to do with saints. Vulnerable. It's because it takes 5 years to mature, so they've got to harvest it. So it's supply and demand, so it's not a cheap herb. But what it does, I digress, I ramble, I'm sorry, but what it does is that it soothes and heals the mucous membrane. It's the #1 herb that any herbalist will use to soothe and heal the mucous membrane. What's a mucous membrane? The tongue, the mouth, the esophagus, the stomach, any cavity that's inside you, your intestines, your anus, your vagina, your urethra tube, any tube has a mucous membrane. And the golden seal is the premier herb to regenerate and repair those, right? Marshmallow is a great herb. I'm not talking about the pink and white ones that you can heat up over a campfire or melt over a campfire. I'm talking about the herb. It's a great demucilin. So a demucilin is something that coats, and when that something is coated, it allows the cells to regenerate and heal without the damage from external forces. Okay. Now, meadowsweet is the premier stomach herb. If the stomach acid's too high, now I mentioned that reflux is generally a low stomach condition, which it is, and it most probably about 95-98% of the time. But in that small percentage, it can be that you're producing too much stomach acid, and you'll know that by go and look at your eye, and where your pupil is, the black. Around that, you'll generally have a brown ring before you get to, say, your blues or your greens, or if you're brown, it's going to be brown on brown. But if it's white, if around the esophagus, if around the pupil it is white, that is an indication of an over-acid stomach. Right? It's a bit of iridology for you. So in that case, what it does is if your stomach acid is too high, brings it down. If it's too low, brings it up, right? So it normalizes and rebalances and revitalizes the stomach, not just the stomach acid, but the whole stomach as an organ itself. So then there's things like slippery elm, again, another great demucilin, which soothes and heals the esophagus, because if you've got a lot of reflux going on here and you've damaged these cells up here, that's Barrett's syndrome, that's esophageal cancer, and you really can't they haven't got a fake plastic tube that they can just stick down there. Or they can if they just continue feeding you like they do in hospital, up your nose and down. So slippery elm helps heal the esophagus and the intestines itself. Aloe vera does the same. Even the amino acid glutamine, which is a semi-essential amino acid, but it regenerates and repairs. It's the amino acid that regenerates, repairs the stomach and the intestines and the esophagus. But with that, a lot of people get a lot of inflammation within the stomach, okay? So pain is a sign of inflammation. So if you've got too much pain going on, that tells me that you've got, obviously a lot of pain. Sorry, sometimes got to smack myself around the head because I'm going a big bloody circle here. Inflammation, you cut yourself and it gets a bit red and a bit sore and a bit hot. That is inflammation, and it's needed to stimulate wound healing. It's called acute inflammation. And that should be, within a week or so, that should be gone. But if that inflammation is still there 2, 3, 4, 5, 12 months later, or weeks or months later, that's what we call chronic inflammation. So chronic inflammation causes tissue degeneration and obviously the pain. The stomach is going to have, and the esophagus are going to be highly inflamed. So it's very hard for the body to heal itself when there's a lot of inflammation going on. So some great herbs, and these aren't herbs that are just like new kids on the block. These are herbs that have been used for thousands of years. Okay, turmeric, been used for 2,500 years in Asia as an anti-inflammatory. Ginger, same as turmeric. I don't know the time frame for that one, but you put them both together, potent combination. You can go buy them or grow them and boil them up. Now, if you're going to, because they're a root or a rhizome, you've got to basically chop them up, chuck them in hot water, bring it to the boil, simmer it for 20 minutes, strain it off, mashed potato down there, strain it off, and then drink it throughout the day. Now that's going to help soothe and heal the inflammation. Nettle leaf, that's been used in Europe for hundreds and hundreds of years, is a fantastic anti-inflammatory, as is white willow. That's been documented back in Egypt for the last 3,500 years. So go back 3,500 years, they were using the white willow, the bark from the white willow tree. Now, another one, which is a common tea that you're going to get from the supermarket, and that's green tea. That's history goes back 4,000 years as an anti-inflammatory for pain. So white willow was used by the father of medicine, Hippocrates, for childbirth, so the pain of childbirth. It's high in salicylic acid, which is, I think that's how you pronounce that word, which is aspirin, which is what the chemical that aspirin was derived from. So there's a lot of really beneficial herbs that are going to regenerate and heal the body. Now, if we regenerate, if we heal, if we provide the body, I should say, with the right nutrients to regenerate and heal, reflux becomes a thing of the past. Now, I've got a protocol that I use in the clinic, and there's even, I'll even put up the treatment protocol under this video if you'd like to download it and have a look at it. There's foods and to avoid and to eat, and stress relief techniques and nutritional supplements that are going to be of benefit for the healing of reflux. But it's not something you take it one day and it's finished. We've been thrown, for the last 100 years, that's basically all that pharmaceutical medication's been around for. We've been brainwashed into take this pill and you will get better. Okay? Well, the body doesn't work that way. The body is not deficient. If the body's got reflux, it's not deficient in Nexium or Somac or Gaviscon. It's not. That is a condition. They are drugs to suppress a symptom. They are not medications to heal. As I said, pharmaceutical medication or pharmaceutical industries are not there to allow you to heal. They want you as a long-term customer. Sorry, it's just the way it is. But you know, if you've got reflux and you really want to get rid of it, it might take you 1, 3, 6, or in severe cases, 9 months to regenerate and heal the body. But as I said, the treatment protocol's got some steps there for you to follow, and that will be quite beneficial. And then as you start to improve your medication, I never tell people to stop medication because you don't want to get all that pain back up again. So it's doing a job, it's keeping you functioning. But as you start to heal and regenerate the body, the pharmaceuticals can just wean off them, right? It's not a life-saving drug. You know, don't get me wrong, I'm not anti-medicine, because there is some, you know, if I'm having a heart attack or I'm, you know, got a major bacterial infection, or leg's just been lopped off, I ain't going to see someone like me. I'm going straight to hospital. Well, hopefully I'm going to get there to hospital. But if I've got reflux, or I've got an autoimmune disease, or I've got, you know, recurring infections or gut problems or liver problems, I'm going to see someone like me because naturopaths, herbalists, Chinese medicine practitioners, acupuncturists, there's quite a lot more. They actually help the body rebalance itself. We're not healers, we're just conveyors of information, right? And we'll give you the right foods. We're just putting you back on the right path. We are healers, but you know, I like you to take responsibility for your own health and the improvement of your own health. Anyway, I've taken up a lot of your time, so thank you so much for watching. If you like it, please click the like, share it on social media. We'd really appreciate that. And thank you for taking the time. Until next time, live life, laugh loud. Have a great day.